So thank you very much, Fiona, for spending some time today to talk to me. What we're doing now is an interview. It's with the Clinical Hospice Manager of Albany Community Hospice in Western Australia. My name's Sabina Clapham. I'm PCOC's Quality and Education Manager. And the questions that I'm asking Fiona today are about the integration of PCOC. So the first question I have for you is, how did you go about implementing PCOC?
That's a very good question, and it's been a long process. So I've been in this role since 2019, and it was already embedded when I came to the role. However, there was mismatched understanding in the team about what collecting this data actually meant, and we were collecting the data and we were tailoring our care to. We also attended the benchmarking workshops where a few key champions of using the assessments were used to understand how we could use this data to help us drive some sort of quality improvement activities.
So does that mean you had, just so that I understand, does that mean you had some champions or a few key people that would lead on not only using PCOC correctly, but also that quality improvement? So starting to build that quality improvement culture.
Exactly. So we started, we basically asked people who would be interested in picking up a portfolio that would explore why we're doing this and what benefits can we get from it. And they then attended PCOC workshops, and that when they came back, they were supercharged with enthusiasm, really saw the relevance of the assessments that were driving data to actually implement change. And from there we went. It created this real culture of, I guess, improvement and curiosity. Why are we doing this? What would happen if we did it this way? And over time, even our quality improvement activities have, I think, been looked at with more depth and understanding. So quality improvement itself as an activity has become less, I don't know if the word is onerous, but it feels to be more meaningful. So, you know, we all know that what we're doing is improving how we deliver the care that we're giving. And when you speak to any clinical team, that is their key concern. It's about the quality of care that you're delivering. So if you can make that meaningful, then I think you've got engagement.
Yeah. How have you managed, so since 2019, how have you continued, I just hear you saying it's continued to grow. Is there anything any tips you can share on how you've achieved that?
So the champions that have championed the cause of PCOC in our organisation, we have formed a clinical leadership team, and we're just a small little 8-bed hospice, and you know, we're a small team, but the importance of quality improvement has been recognised by these champions, who every time we get our 6-monthly outcomes report, we have a meeting, we look at the data, and we make a decision about what it is we're going to target for quality improvement for the next. And it's a little bit of the reward sort of scenario where we can see what we've put in place actually worked or it didn't work. So it becomes a little bit infectious when we see that we've won, you know, some little minor, you know, basically our staff have been more educated or they feel more confident doing an assessment because they've learnt a new skill or they're supported in their learning. So we start to feel like we're making a difference even in our staff education. Not only are we making a difference in the care that we're delivering to our patients.
Yeah, that's great. It leads us to our next question, which is, how does PCOC benefit your patients and their families?
Well, I think that the first and most relevant part is that the patient is at the centre of the care. They're the ones that are being asked every day or as needed, how are you experiencing being you? You know, what is distressing you today? What is distressing is it your family, or when the patient can't speak, how do you feel your loved one is experiencing this moment in time? So definitely that patient-centred care, which is the gold standard. I mean, everybody who's in healthcare wants the patient to be at the centre of care. So I think that, you know, PCOC, these assessments and what evolves from those assessments really supports that. And then rolling on from the assessment, when staff get together to collate their assessment, it results in better care because we're all operating from the same song sheet, so to speak. We're all able to plan and target. So we're all having to assess, plan and implement care that is coming from the same direction. And there's a common clinical language that we use that means the same for everybody. So we're sort of going to get more consistency in care that's delivered to our patients because of that.
Yeah, that's excellent. Could you just explain how you use the SAS? What does it look like normally when you're using the symptom assessment scale for most?
So we have a laminated SAS that we take to the patient every day, and those that are able to physically write their own responses in a discussion that is had with the clinician at the bedside. And for those patients that are unable to do that, then the staff would have that discussion with their carer or their loved ones and would fill that in for them. So, and then those SASs would be translated into a digital form on our software package and entered onto a system where, you know, following a few other processes, we would discuss amongst ourselves what their PCPSS score is and, you know, have a discussion around the Karnofsky and their rugs. So that's how then that gets inputted into our system.
That's really excellent. My last question, and you've probably also talked a little bit about this, is how PCOC benefits your team, your staff, and the service as a whole.
Well, I think that every manager, their focus is about providing timely, accurate and supportive education to their staff to do the job that you want them to do and that they are here to do. So I think that PCOC certainly, first of all, provides that because it very clearly defines where we need to focus our activities every moment of the day when we're at work, by the patient telling us what they need the most from us. So staff are feeling supported in their understanding of assessing need. They're also feeling supported because there's a framework to direct how they will proceed. There's also a very common clinical language used so that there is less subjectivity and people are able to, if you will, get on the same track of thinking, planning and moving forward. And I think for us as a service, PCOC is, it's just helping us to be better at what we do all the time. It's just a rolling quality improvement project that, you know, by doing the care that we do, we're monitoring how we do it and really what we could aspire to be doing better. So it's really good. Yeah.
Excellent. Thank you so much for your time in discussing what PCOC does for you and how what you've learned along the way. It's been really important. Thanks so much for your time.